Welcome to Environmental Law Explored, a podcast series, the podcast of the American Bar Association section of Environment, Energy, and Resources.
Hi, everyone. Welcome to the Enforcement and Litigation Committee's Emerging Contaminants podcast series. Today's episode is on pharmaceutical and personal care products, also known as PPCPs. My name is Victor Hsu. I'm an environmental attorney with Marten Law, LLP, and my practice focuses on representing municipalities, businesses, other governmental entities on water quality, natural resources, and other environmental issues, including addressing emerging contaminants of concern. And joining me today are Bill Arnold and Eva Weiler. Professor Arnold is the Distinguished McKnight University Professor and Joseph T. and Rose S. Lang Professor at the University of Minnesota. His research currently focuses on understanding the fate and transport of man-made chemicals in natural and engineered systems, with the ultimate goal of predicting contaminant fate in aquatic systems and designing treatment technologies for contaminated waters. His current efforts include, among other topics, studying the photochemical fate of pharmaceuticals and pesticides, studying reactions that occur at mineral surfaces, and remediation techniques for fluorochemicals, as well as detection of micropollutants in aquatic systems. Eva is a partner at K&L Gates based in Orange County, California. Eva is a member of the firm's mass tort and product liability practice groups. She specializes in complex, science-driven class actions, multi-district litigations, and other high-stakes and large-scale matters in federal and state courts across the country. Eva has broad experience in the industries of pharmaceuticals and supplements, medical devices, construction, utilities and security products, consumer goods and food and beverages, vehicles, and environmental sustainability. She also frequently advises companies on labeling and marketing, including with respect to the FTC Green Guides, biodegradability, recycling, and ingredient characterization. To start off with, Bill, you've been studying what's called PPCPs for over 20 years. Now, what do people mean when they refer to PPCPs? And sort of why are these substances grouped together for purposes of studying or analysis? Basically, what's the big deal?
You're right. It's a very broad category of chemicals. And an easy way to think about it first is medications. Anything you take for pain or illness or sickness or chronic conditions that you ingest and then excrete out of your body, that's a pharmaceutical. The personal care products is a little bit broader, right? These might be things that are non-prescription, cleaning agents, disinfectants, and it might even reach into the category of pesticides in some cases too, things that you use in the household to control ants or rodents or the like. So the reason they're grouped together is a lot of them are used in household use, right? So they're used by people for some purpose. The other thing that's true as well is that some of them are used by animals. So we give antibiotics to our pets and to farm animals. And so it covers a broader range of things than just humans, but that's where it really started, was with what chemicals are used by humans around the house. And then analytically, what happened is there's a technology called liquid chromatography, tandem mass spectrometry, and it's been evolved into other mass spectrometry techniques. And this was a category of analytical tools that allowed pharmaceuticals to really be detected in various environmental matrices about 25 years ago. And it really couldn't be done effectively before that. And because the method is the same for a lot of these chemicals, they tend to get grouped together that way as well.
Can you discuss a little bit about the scientific advancements that cued us into the existence of this group of chemicals in terms of our water supplies and in the environment, and just how it became a set of chemicals of emerging concern?
So I think there's two parts to that question. And the first one is the analytical part. So the extraction techniques for environmental samples got better. The instrumentation got more sensitive, and we were able to see chemicals at much lower levels than we were before. And the other part was the realization that a lot of these chemicals are biologically active. They're meant to have some physiological effect on people or kill bacteria if they're more of a disinfectant that's used in the house. And so there became concern that some of these chemicals, when they were released into the environment, might have unanticipated environmental effects. And I think what really triggered some of it initially was estrogens. And estrogens are both man-made chemicals, so for example, the birth control pill, but then whether you're male or female, you also excrete various hormones. And hormones operate at really low levels. And so there was some evidence that hormones being put out into the environment were disrupting aquatic species. And that led to the looking at a much broader range of pharmaceuticals and personal care products.
And what sort of environmental matrices do PPCPs end up in?
By and large, the PPCPs wind up in water and sediments. And so we take the medications, we excrete them, they go into the sewer system. The wastewater treatment plants then receive our sewage. And the wastewater treatment plant's main goal is to remove carbon, nutrients, and the like. They're not designed to remove trace levels of pharmaceuticals. And that said, they do a pretty darn good job of it. They remove a lot of pharmaceuticals, but not all of them. And then the wastewater is discharged into rivers and streams. Out in California, it's put into various places so you can reuse the water as well. And so that is a major source. And then, of course, depending on whether the chemicals like to be in the water or they're more hydrophobic and want to stick to particles, they might wind up in the sediment as well. And that's just the human aspect of this. And we use, various cleaning agents, pharmaceuticals with animals as well. And so if you're feeding some kind of pharmaceutical to pigs, how that manure is handled and processed, eventually there might be some environmental release that way as well.
So, as you said, PPCPs are this incredibly broad class of compounds. So, I just wanted to drill down a little bit and focus on the research you've been doing, Bill. What are some of the particular substances you've been studying, and what have been your key observations and conclusions?
So I've been doing this for 20 years, and so it's hard to pick and choose, but I'll give you the most current things that we've been working on. One of them is the class of compounds called quaternary ammonium compounds. And these certainly fall into the category of I'll call it personal care products. These were the disinfectants that we were all using to wipe everything down during the COVID-19 pandemic. And so the usage has gone up because of that. And we were using them a lot before. If you have antibacterial soaps, quaternary ammonium compounds are the disinfectant in there, various cleaning sprays. So a lot of that winds up going down into the sewage system. And it turns out we use a lot of these compounds outside as well. Like if you've got moss on your roof, it might be a QAC that's used. And so we've been looking at the loads to the environment, and we realized that 99% of them are removed in wastewater treatment plants, but we use so much of them compared to other chemicals that the 1% that gets out is a much larger mass than most other pharmaceuticals that we see. And we've also found that various sources that aren't household use are leading to their introduction into the environment as well. And the other broad category we've been looking at are fluorinated pesticides and pharmaceuticals right now. As I'm sure hopefully most people who are listening to this are familiar with the term PFAS. And it turns out by PFAS definitions, there are a lot of pharmaceuticals and pesticides that are also PFAS. They have a fluorinated functional group on them. And so we've been looking at how those chemicals enter the environment and how they degrade and what byproducts they might form, and whether or not, even if the original fluorinated pharmaceutical or pesticide isn't a PFAS, whether one of the reaction products is. And so one thing we found there is that a lot of these chemicals form trifluoroacetic acid, which is the smallest PFAS molecule when they're exposed to environmental conditions.
Eva, wanted to give you a chance to weigh in. You work a lot with players in the pharmaceutical industry, medical devices, consumer goods, food and beverage. Was wondering, with obviously without revealing any client confidences, but what about PPCPs people in the industry are thinking about, what they're aware of, and how they're approaching the issue?
Yeah, pharmaceutical companies and personal care product companies fundamentally care about providing products to consumers, aka patients in many regards, that they actually need. And with so many companies who actually are conscientious about sustainability issues, they're seeking to balance ingredient choice with also producing medications and products that people actually need. So when we talk about kind of the top level chemicals, products at issue within the water, we're looking at things like stimulants, that's caffeine. We're looking at mood stabilizers, that's like sertraline. We're looking at cholesterol-related medications, painkillers, ibuprofen, not even opioids, those are on the list, of course, but regular old ibuprofen and Tylenol, antifungals, antibiotics, and certainly those estrogens and hormone-based medications, and not just the medications themselves, but products that can affect hormones, what we would call endocrine disruptors. Those are of a particularly high concern because of the need by consumers for the medications that affect those systems within the body, but then also understanding the impact that other chemicals can have on those systems. I think most of the industry is trying to accommodate consumer and patient needs while picking the best ingredients they can that do the least harm. We see a lot of progress or a lot of steps being taken across the pond, so to speak. And one example of that is the Environmental Agency of England and Wales had proposed a ranking system for some of these chemicals according to perceived relative risk to help companies understand what's really at issue. And that system used a combination of traditional risk assessment procedures, persistence, bioaccumulation, and toxicity criteria, occurrence data within various countries, availability of the analytical methods, and they really aim to include the compounds that were representative of different therapeutic classes of medicines. And kind of the top 10 that they found were indeed kind of what I just mentioned: antidepressants, opioids, pain relievers, antifungals, antispasmodics, even bronchodilators, along with different hormone affecting products.
Bill, how developed has the science been in terms of connecting these trace, almost, imperceptible levels of certain substances, like Eva said, antidepressants, opioids? You mentioned estrogens and androgens. How much do we know about how those trace levels affect human health?
Human health is the big question for all of these things. So a lot of the evidence we see is, I'll say, environmental health. And we know that some compounds like the estrogens and the androgens at nanogram per liter levels can affect things. Other things that might be microgram per liter. And sometimes it's, I'll say, you have subchronic issues. So if you have antibiotics or biologically active chemicals that affect bacteria, they might not trigger resistance at the level they're at, but they might help maintain resistance in the environment, the levels they're at. In terms of human health, I am not a human toxicologist. So we know that these chemicals have human effects because we take them for that specific purpose. But in general, the levels we would get from most pharmaceuticals coming back to us in the environment would be below those dosage levels. But again, not being a human health person, it's hard to figure exactly that out. And then the other big question is mixture exposure, right? So if there's lots of different chemicals in the matrix, how does that work? And also, I want to say here, first of all, a lot of our exposure to these chemicals is not environmental necessarily, right? So our drinking water treatment removes almost all of these chemicals that are put out into the environment. The exposure we get is much more is from the medications we take or in product usage in the household. So it's purposeful exposure, not accidental. Pesticides are a different story, but we could talk about that in a different podcast.
So would it be fair to say that in terms of understanding PPCPs as an environmental contaminant, that researchers are by and large focused on fate and transport at this time, and there remains to be more to be done in terms of human health effects?
Yeah, they're more focused on fate and transport and then effects on environmental species, which of course we want a healthy environment for humans to live in, right? And so if we're affecting ecosystem function with some chemical we're putting out there, that is going to affect humans in some way. And there are always chemicals in the environment that are going to make their way back to humans. We have evidence of things, that bioaccumulate and transfer. Pharmaceuticals generally don't have the right chemical properties for that. Estrogens may.
The developing human health side of it can explain why, at least in the United States, PPCPs are something agencies are aware of. EPA has a page on it, but hasn't done much more than having some information. Eva, you addressed some of what countries in Europe are doing about PPCPs. What are you expecting on how states, localities, or the federal government in the United States will be responding to PPCPs as the science and public knowledge of that science develops?
Sure, and I can address more on the European system in just a minute, but with regards to the US, the basic concepts for potential regulation here would be things like water monitoring, water remediation, banning of certain active ingredients or limiting them, might include designation of responsible persons or company in terms of regulatory compliance and tracking, and potentially traceability of certain raw materials and sourcing and finished product testing. But within our framework now, there really isn't a regulatory framework for what these companies are supposed to be doing with regards to PPCPs in the water. And frankly, what we've seen of late with the current national administration, I don't expect much movement from the federal government in regard to this anytime soon. We've actually seen, on the contrary, elimination of certain EPA programs, including funding for the EPA's scientific research arm, the Office of Research and Development. And we've also, kind of on the flip side, seen movement regarding international tariffs that would support administration wanting to bring more pharmaceutical manufacturing back to the U.S. So if we're limiting funding on the EPA front, which would dig into kind of the scientific research and potential regulation, and then we're at the same time trying to encourage pharmaceutical manufacturing to come back stateside, those two things don't seem to go together, because if we were to start limiting and regulating the pharmaceutical industry with regards to PPCPs, kind of like Europe has, that part of the concern right now is that that will actually impact in a negative way the development and manufacturing of further pharmaceutical products. So I don't really see much from a national standpoint coming up immediately. That said, on a more local or state level, especially within states that tend to have a more pro-environment or greener profile and legislative agenda, for example, in California, we could see some legislation, at least with regard to additional chemicals being excluded or limited in terms of their use, adding more compounds to lists like Prop 65, but with pertinence to pharmaceutical companies or personal care products. Along with that, though, any additional regulation will require infrastructure and cost management. So if that comes out, who's going to be paying for it, which is really part of the issue that's going on in Europe right now.
Like you said, the state of regulation is in its infancy. However, based on what you've seen for other environmental contaminants, such as PFAS, do you have any thoughts on what kind of litigation, if any, we can expect in the PPCP space, whether it's, in 5 years, in 10 years, or in the distant future?
Sure, there's multiple layers to this. And I think the most obvious that always comes to my mind, given my practice of law, is I think about tort lawsuits. I think about tort lawsuits being brought by a class or as a mass tort alleging harm and injury due to exposure from contaminants in the water. You could have, your standard common law claims, but you could also see something a little bit different, like a failure to warn, and or something even more novel, like innovator liability for failure to develop safer alternatives. There's some of that percolating in California with regard to HIV drugs, and it's a new concept. And you could potentially see something like that coming to bear on different types of lawsuits in tort. But, of course, those types of lawsuits will have a proof problem, which Bill kind of hinted at earlier, where you have mixed exposure. So being able to sue, for example, a particular company because you believe you were injured as a result of exposure to one particular type of pharmaceutical, even though you never took it, you're going to be exposed to those types of things through many other ways, intentionally or accidentally. And so parsing out whose fault that is becomes very difficult. And our state of the science is not there And I can't really, Bill could comment probably on whether he thinks it'll ever get there, but that would be a significant hiccup to that type of a lawsuit. You also could see citizen type suits that would allow a group or individual to sue a person or governmental instrumentality or agency regarding a violation of a federal environmental statute, for example. That means a citizen could sue the EPA for failure to perform a particular duty in regards to protecting the public. So if a law required the EPA to do something, but EPA didn't do it, a group or individual could sue the EPA administrator to compel that action. For example, under the Clean Water Act, the Safe Drinking Water Act, etc., a citizen has the right to sue an alleged polluter in federal court for violations of the law, seek injunctions, civil penalties, and attorney's fees. You could see environmental remediation type actions, either by a local water board to seek cleanup or remediation of a particular groundwater. But in that kind of instance, you'd have to show a direct connection between that polluter and the particular contamination in the water. The same would be true with a CERCLA, Superfund, RCRA type site, where they allow for cleanup costs from potentially responsible parties. So you could see those types of actions, but again, making the connection to one particular source becomes difficult. You could also see a suit being brought by the EPA itself against industry. You could see citizens seeking an administrative petition from the EPA for rulemaking, i.e., EPA, you haven't done anything on this. We want you to issue or amend a particular rule with regards to PPCP contamination. But if that type of rule came down or a particular type of legislation came down, we would then go to the types of suits that are being filed in Europe right now in connection with the development of their newest legislation at the beginning of this year. Finally, you could also probably see a state suit. Sometimes when you don't see action by the federal government, a state can bring a suit against the government for failure to protect its citizens, although that's very rare. But that could be another option as well.
Since Eva called you out, Bill, wondering if you have anything to add on how you expect the technology to advance here.
We know how to remove these chemicals from water if we choose to do so, right? We can use an advanced oxidation process or alter the biological treatment in some way. The question is whether we have the economic resources to do so. It's expensive to add an ozonation step on the end of a wastewater treatment system. And there's a large carbon footprint to that as well. It takes energy and it takes money to do that. And so if we decide that there is an unacceptable environmental impact or a health risk, we do have some technologies available to us now. And I think the other possibility that Eva pointed out earlier is that the companies want to be responsible as well. And if we can provide tools and understand the environmental fate of the chemicals better, we can provide information to feed back to the pharmaceutical industry that will help them design drugs that are useful, but also environmentally degradable.
Got it. And Eva, you've been referencing the European Union's approach, and I understand it's been taking a more aggressive approach compared to anything that's happening in the United States, generally speaking. So what are we seeing across the pond?
Back in November of 2024, the Council of the EU greenlighted a revised directive. They called it the Urban Wastewater Treatment Directive on urban wastewater treatment. And per that directive, member states are required to collect and treat wastewater in more areas than they had before, as defined by a smaller population. They have to remove biodegradable organic matter from urban wastewater before discharging it into the environment. And they're removing nitrogen and phosphorus from urban wastewater as well, and those have different timelines. Now, the pharmaceutical and cosmetics or personal care product industry are roped into this because there's also a requirement for quaternary treatment, which is AKA micropollutant removal, and the industry has been ordered to foot a huge percentage of that bill. In particular, this directive obliges the member states to require producers who place on the market products falling within the scope of either the EU Medicines Directive or the EU's cosmetics regulation to pay for at least 80% of the full costs, including investments and operational costs of the required treatment of wastewaters to remove those micropollutants, and 100% of the costs of gathering data on the products placed on the market and other associated costs necessary to ensure the payment of these micropollutant removal costs. Producers can be exempt from this requirement, but it happens only if the quantity of the substances contained in their products that they place on the market is below 1 ton per year, or the substances in the products they place on the market are rapidly biodegradable in wastewaters or do not generate micropollutants in wastewaters at the end of life. So, and there'll be a follow along detailed criteria as to which products would fall into that bin. So this entire system is based on an extended producer responsibility, which places financial responsibility on producers of these products to treat those micropollutants. And it aligns with this concept of polluter pays, meaning the companies whose products contribute to the pollution are ultimately held financially responsible. And that applies here regardless of whether the products are placed on the market or whether their individual components were manufactured in a member state or third country, or whether the producers have a registered office in the union or the products placed on the market via digital platforms. So pharmaceutical and personal care product residues, according to the Commission, represent the main sources of these micropollutants found in urban wastewater, which is why the heavy burden of the cost is being put towards them. And in an effort to avoid putting it on the taxpayer and with regards to water tariffs. In the actual language of the directive, they talk about this as an incentive to industry to create greener products. The only downside of this is that, on the contrary, if industry is footing such a large bill, they are now complaining to say, look, if we have to foot such a large bill, it's going to crush medicine development, product development. One estimate I saw was that the cost of metformin, which is a very commonly used diabetes medication, could go up by 900%. And obviously there's limits on raising the cost of those prices of medications in the EU, which would then affect availability. So right now, there have been a series of lawsuits brought by industry against this regulation in the Court of Justice of the European Union. There's approximately 16 cases that have been brought already. And it's not that industry is challenging that they should participate in cost sharing. On the contrary, they have made statements that they are in favor of paying their fair share of the pollution, but that it has to be indeed a fair share. Some of the data that was utilized in analyzing and creating this legislation was not shared. And so pharma and personal care product industry are basically saying, hey, it's not just us that is putting these products on the market. There are other contributors, and those contributors also need to be involved. If we truly want to incentivize companies to create greener and more sustainable products, we need to do it across the board, not just isolate for one particular industry.
That's really interesting. And Europe has always kind of been the leader in extended producer responsibility. We're starting to see programs like that in the United States as well. I know there's packaging EPRs programs in place, and for example, for plastic packaging in California. Could you see in the future something like those EPR systems in the US being used for PPCPs?
It could be. I think we have to be careful about seeking perfection and having perfection overcoming good progress. I think there are many companies already trying to make sustainable and green choices, but are often caught in the crosshairs of certain types of litigation where maybe it's not perfection that they've reached, but they've managed to make more sustainable and greener choices, but are now having to take a back step because they're subject to litigation that says they're being misleading about how they're putting together their packaging, for example. So we can't let perfection be the enemy of good in this. I think there is a lot of space to make change for the positive if we try and bring kind of, if I could say, both sides together to really create better products for everyone's health and for the environment.
I'll quickly comment. There are some, I'll say, baby steps in that direction. For example, there are take-back programs, right? This doesn't affect medications that are used, but for unused medications, the advice used to be put them in the toilet. And now it's take them someplace so they can be disposed of properly, which usually means incinerated, so that they don't wind up in the environment. That's a small piece of all the medications that are used, but it is one step that prevents exposure and environmental release.
Definitely. Just wanted to make sure that I covered everything. Is there any question that you wished I asked?
I'll quickly comment just one other challenge in all of this too, is that as these compounds degrade in the environment, we don't know everything that they form, right? And so we're often worried about the parent compound, but sometimes the byproducts we have to worry about too. And that's just a whole another level of complication in both the science and the regulation of all of this.
And that's important because the byproducts presumably have different health effects or behavior and transport than processors.
Yeah, they'll transport differently. Usually they'll be less biologically active, but there are cases where a breakdown product is more toxic or more biologically active than the parent molecule.
Great. Thank you so much, Bill and Eva, for your time today. This has been really insightful. And I'm sure as the science and public attention grows regarding PPCPs and how they move through the environment, what human health effects they have, that we'll be discussing this again in the future. So looking forward to that. And please tune in to the next episode of the Emerging Contaminants podcast. Thank you.
We hope you enjoyed today's episode. To learn more about our section, please visit our website at americanbar.org/enviro. Please check where you found us for future episodes. Thank you for listening.